Welcome to Insights from the Eye Center, connecting patients to eye care solutions. Now, here's your eye care team.
Hello, everyone, and welcome back to another episode of Insights from the Eye Center. Jeremy Wolf here today with Dr. Madrigal from the team, and we're going to get into, this is a topic we've actually discussed before, but today we're going to do a little bit of a deeper dive, and that is specialty contact lenses. We're going to go over a recap, talk a little bit about what they are, how they work, who they work for, some of the new technologies that have come into the picture since we last spoke about this, and really how this technology and these types of lenses help people live better lives. But Dr. Madrigal, you ready to get into this? I got a bunch of questions here to pick your brain and really enlighten us.
Yeah. Thanks for having me on here again, Jeremy. And this is an area that I'm really passionate about for a number of different reasons, mainly because we can help people see better and feel better. So it definitely is an area that I feel really, really confident and really makes a difference, I think, for a lot of patients.
Absolutely. Okay, so last time we covered this topic, specialty lens broadly. As a quick recap for listeners, how do you define specialty lenses?
So specialty lenses I think of as a basically personalized medical device, and it goes way above and beyond just a standard vision correction, because we're not just looking at vision, but we're also looking at a completely personalized lens for your eye based off of the shape and the curve.
And do these fall under the category of soft and hard lenses, or what's the distinction between specialty lenses and then your standard typical run-of-the-mill contact lenses, like disposable lenses that people use?
Yeah, so I consider specialty lenses anything that we basically get personalized for a patient, but that's a kind of a trick question because in this realm we do have completely hard lenses. So for a long time we've been using a lens called the RGP, which is a small lens that lands on the cornea or the front part of the surface of the eye. And then there is the lens that's called the scleral, which is a lot larger. Although it's a larger hard lens, it's actually one of the most comfortable lenses. And what it does is it vaults the entire cornea. So it lands from the white part of the eye to the white part of the eye. And then another consideration for the specialty category is what we call a hybrid lens. So it's a mixture between the small hard lens and then it has a soft skirt. So depending on the patient's visual needs, what they've worn before, or what our vision goals are, depending on the exam, then I'll recommend a specific direction to go in when it comes to these specialty lenses.
Interesting. What are some of the common issues or eye conditions that push you to consider a scleral solution versus a more standard type of contact?
Yeah, so we used to think of sclerals mainly for people who had an eye condition called keratoconus, and this is when the cornea is misshapen and creates a cone over time. But we've actually found that scleral lenses can be really helpful in other conditions such as dry eye disease because it helps keep basically a saline or tear reservoir on the eye. Some patients after LASIK also who have some difficulty with glare are really great candidates. There are some other corneal diseases and scarring that can be improved with vision. And I even have some young athletes who don't feel like their vision is as sharp in their soft lenses, and the stability of a specialized lens gives them that edge in their vision. So honestly, almost anyone could benefit from a specialty made lens for them.
Okay. In terms of like fitting and adaptation, what does it look like? What does the journey look like from the first consult to actually getting into these scleral lenses? Walk us through that process. I come in, I've had LASIK. I wear glasses now for reading, but my distance vision is going. I came in to see you guys. I was interested in getting into this. What does that, walk me through what I am to experience as a patient walk into the door to the eye center. How does this process work for me?
Sure. I would say in general, I usually like to start with a comprehensive eye exam. The comprehensive eye exam, we look at the health from the front of the eye to the back of the eye, and we also evaluate your vision goals. So we'll check for glasses, and based off of those measurements, if we see something where glasses can't correct your vision or if we see something on the surface of the eye where we think a specialty lens would give you better vision, then that's the next step of the process. So I am the doctor in the office, the director of the specialty contact lenses. So you'll either be, if you're not coming in to see me, one of the other doctors will go ahead and confer with me. We'll look at some of those images. And then I like to start off by asking what our goals are for vision. So, for example, if you had a condition called keratoconus, which you don't, you just had LASIK, but if you had a medical condition, then we discuss about the condition progression. And then we talk about, so if you did want some contacts that could help you for distance and up close, then we talk about some of those options in the scleral lens. The scleral lens, like I was saying earlier, is one of the most comfortable lenses, but usually I would show a patient if you've never seen one before, because it can seem a little bit daunting since it is a larger lens. The evaluation.
When you say larger, how much larger are we talking about? Is this something that covers like a large portion of the eye? Because I've had contacts in the past, the disposables, they covered basically
The color part.
the color part.
Yeah,
There you go.
so
Word.
they are a bit larger than just that. It usually can go from the white part to the white part. On average, if we're talking about like millimeters in diameter, they're about 16 millimeters in diameter, but some can even go as large as 18 or 20. So there are some that can cover like the complete white part of the eye. The reason why I tell you about the comfort is because it does seem like a larger lens would be more uncomfortable, but we actually have less nerves on that part of the eye. So the most sensitive part of our eye is the cornea. And because it's not landing on that part at all, these lenses, like the first thing I hear when I place the lens on the eye is, wow, this is really comfortable,
Really?
surprisingly. Mhm.
Yeah, you wouldn't think that having a larger lens, but I guess they're fit in such a way that there's all sorts of new technology available that are making it fit as snug and secure as possible. I'm curious though
Correct.
about from like my perspective where I'm sitting right now. I just got glasses for reading, as I said. Would I even be a candidate for contact lenses in that my issue is mostly reading up close. We're mostly seeing up close and not what is it? Far nearsighted is I always get confused with nearsighted and farsighted. Nearsighted is see far, and farsighted is you can see near. Is that do I have that right, or am I backwards?
Correct. Yes, you have it. It's a little
I had a
confusing when you think of
50-50.
it that way.
I had a 50-50 chance.
Yeah.
But if I came in, right, and because one of the issues I have now with my reading glasses, I tend not to wear them too often. Like I just default to not using them. If I came in and wanted to get specialty contact lenses, do they have a solution that works when you have this issue that I have? Or is it only for particular cases where you can't see far, or I guess it depends on every patient because everybody's different, I'd imagine.
Yes, definitely. I would say in general, so it sounds like we might need what we call a multifocal. So this is a lens, and they do have this in the soft contact lens as well.
Hmm.
But basically, it has these rings that help you with focusing. So unlike a progressive pair of glasses that you can only see distance in the top part and then reading at the bottom, these rings work with your pupil or the dark circle in the center, and it can actually help you focus if you want to read something on the right side, read up, down, even probably because it's working on your pupil and not necessarily the direction where you're looking in.
So you're telling me this is all interesting. I think I need to come in and get examined.
Yeah,
There
it sounds
there
like it.
could potentially exist a specialty lens that I could put in and it'll solve all my problems. I do have an issue seeing far, but not terribly. But if there was one solution that I could put in, because when I put the reading glasses on, it makes me I can't see far. Right? I got to take them off when I look at it. It bothers my head. It gives me a little bit of a headache sometimes, which is part of the reason why I probably don't wear them as much as I should when I'm reading. So there's a solution out there potentially that I could just put a lens in the morning and I'm good all day, near and far.
Yes, definitely. Yeah,
I'm
that's the
sold.
multifocal technology. But just going a little bit more in depth, since we're talking about some newer technology that we have in the practice and in the fitting process. In general, these lenses back in the day, we would have to place diagnostic lenses on the eyes and then take measurements of where they're landing. But we actually have now incorporated the iPrint technology into the office. So now instead of placing a lens and taking measurements, we can actually place a mold similar like dentists do of the mouth and the teeth, but place it on the eye and mold a lens precisely between 5 microns of difference onto the eye, which is super, super specific. And if there's patients who've been wearing hard lenses previously that have been having issues with comfort or vision, this technology allows us to do even more than just adding a multifocal.
It's so funny. We're talking about this, and I'm sitting here and I have some notes in front of me, and I don't have my glasses, and it's hard for me to read everything. My eyes are starting to hurt. Oh goodness. So yeah, I am fascinated by the iPrint technology. I was looking over the site, and I want to get a better understanding of how this works. So the iPrint Pro, walk us through. Is this I come in, is this something where I just put my head in a scanning tray and it does, like, how long does that process take? What, go a little bit deeper into the iPrint Pro process and how it works from start to finish.
Yeah, so if you were, it sounds like you're not a contact lens wearer. So if you haven't placed any contacts in your eyes, essentially, once we do our evaluation and decide that this is the best option for you based off of your history and the scans of your eye, we actually have this material that we would place onto the eye. We use like a small tray. Sometimes we'll instill numbing drops as well just to help with tearing. But in general, this is something that is also seemingly pretty comfortable and tolerable. And we actually place the goo onto the eye. And
Ooh.
then over 60 seconds, it starts to harden almost like a Play Doh kind of feeling. We remove the impression from the eye on the surface, and you can actually see the impression of the whole front surface of your eye. What this allows us to do is that we take this impression and send it to the company, and they actually will scan it like a 3D scanner, and they're actually able to correct with the software, create a lens specific to a person. This is the most specific lens that anyone can ever have created. And once they are able to get that manufactured, when the lenses come back in, they're completely customized, like I was saying, up to 5 microns to the surface of someone's eye.
It's fascinating. I see what you're saying about you looking at this as a medical device. It makes perfect sense, right? As the eye deteriorates and the lens gets warped, for lack of a better words, to go in there and basically make this impression and customize the actual technology, the lens, to do what the eye is intended to do in the first place. I'm sold.
Mhm.
When can I come in? When can I schedule?
Yeah, and this company they're called the iPrint Prosthetics, and it's a name. So the name iPrint is almost because it's as unique the front surface as like our fingerprints. So every eye is unique in different ways, but the prosthetic part comes into hand because some people's corneas aren't able to see as clearly, and so I almost think of it as like a prosthetic cornea. So that's as big of a difference as it can make it. It can help someone go from being unable to drive to being able to drive, function, work, and live a normal life.
Fascinating. Pretty soon they're going to be printing new eyeballs for people that have lost their vision entirely.
Honestly, I wouldn't be surprised. The technology is really advancing. And I know there's a lot of patients that can be frustrated or wearing contacts or unhappy with their vision or not stable or comfortable. And this has been like a huge game changer for those patients too.
I know we talked about this over a year ago, but this iPrint process, was this in existence when we first spoke? I can't recall, or is this a brand new technology that's just coming into fruition over the last year or so?
Yeah, so it's been around for some time, but I think it's been gaining a little bit more traction lately. And there's only a few offices in the state of Florida that even offer this kind of technology. There are some other methods to visually scan the front surface of the eye, but the specificity of it is not as close to 5 microns. So this is really the most specific technology that is out there right now.
And why do you feel it is that there's so few optometrists that are out there offering this service if it's incredible for people? What's been holding back from this becoming more mainstream, in your opinion?
I think there could be a few different reasons. Sometimes it's a little bit more challenging with insurance. So we have a whole insurance department that kind of has that process with patients or that discussion. And sometimes the impression portion isn't something that's covered by insurance, but because it's of such benefit, and once an impression is made, it only, unless the eye changes, only has to be done once. And then after that, we can make changes over the years. It's something that is might be somewhat of a barrier for some maybe optometrists.
So is it, generally speaking, is it a, without insurance being at play, is it a costly procedure? I'd imagine it is.
Because the technology is more advanced, there is a little bit of a cost difference between the standard contacts and then with the iPrint because it's so specific and the process is a little bit more complex. But in many cases, it saves a lot of time. And the way I like to think of it is appointments to come back in and recheck or review takes time. So a lot of patients will value their time and getting something that they know is more precise or even healthier for their eyes if it's going to be more comfortable and visually better. So I think that the value really is in all of the other things that we see with this lens.
Now, once, let's just say I were to come in and have this scan done and get some of these lenses made and it worked, is this something, what have the studies shown in terms of, is this something that I would have to come back and make adjustments frequently, or is this, has studies shown that this is good? Once I come in and get these lenses done, I'm good for many years, or how does that typically work?
Yeah, as long as your cornea or like the shape of your eye doesn't change drastically, typically just getting one impression as needed is what they've shown us. I think it's a little bit newer in our office, so we haven't really set a guideline past 1 to 2 years. In general, the material of the lens usually will say between 1 to 2 years, depending on how rough we are on the lenses. After 2 years, with the scleral lens specifically, they can warp a little bit, so the vision can become compromised. At the end of the day, it is a type of plastic, which we know doesn't last forever. With some of the other specialty lenses, they do have different like timelines. So the hybrid lens is only good for 6 months, and then the RGPs, we typically like to stick to 1 year. And again, it's just depending on the thickness of the material, but how long it's really meant to last. And at the end of the day, it's something that we're putting in our eye and taking out. So we want to make sure it's something that is still safe to be used.
Now, am I leaving with one pair of these lenses? And then do I, like in terms of maintenance, do I take them out and clean them every day? Do they stay in longer? Or do I have multiple sets that I go back and forth from? How does that typically work?
Yeah, so at the end of the process, so from that first day that you were fit, we would give you a call once the lenses are in, and we'll teach you how to put them on, take them off. Typically, these lenses, because they're a bit larger, we fill them with a saline solution, and that's what bathes the eye with the lens. And then we would teach you how to clean them. So they're meant in general for daily wear, so placed in the morning and then removed at nighttime before bed. We teach you how to clean them and then how to care for them. Usually, we follow up a little bit sooner just to make sure that the vision goals are met and that we're not having any difficulty. I always will review the possible solutions that we're using. Once everything's been finalized, you have one pair. That's your pair to take care of and to use for the year. After that, typically we'll say that's when we start to just follow up as needed. But it in general, we don't have like multiple pairs or anything. At the end, you finalize with one.
All right, no backup. Take good care of the one that you have.
Yeah, if you saw the lenses, it's really, I want to knock on wood, but it's really difficult for these to become broken or anything. They're one of the more durable lenses.
All right. And what are the types of conditions, right, or anatomical challenges that typically benefit the most from using the iPrint process?
Yeah, so I would say in general, and this is something that we see really commonly being living here in Florida,
Uh-oh.
patients who have any irregularity on the white part of the eye where the lens lands on. So traditionally, this would be someone who has like what we call a pinguecula or a growth from the sun. Pterygium, if you've ever seen, it looks like almost a little bit of a yellow, glossy nasal area from the sun. So all of these like bumps that we can have typically are more difficult to cover with a standard lens. So with the eye print, it actually will be able to vault over it and not land harshly on those kind of like growths.
Okay. So if I understand correctly, potentially everybody could be a candidate for this type of procedure. Really doesn't necessarily matter on the condition. If you have some vision issues, this iPrint process could potentially benefit you. Am I getting that right?
Correct. Yeah. So it could ideally be a good option for anyone. But if you have any particularly difficult anatomies or any specific like surgeries, then it might be an even better option.
Okay. Now, and from a practitioner's point of view, when it comes to the use of these equipments and using the iPrint process, is it pretty straightforward? Are there any specific training or equipment differences specific to the iPrint process that different from your standard treatment options that you've had in the past?
Yeah, definitely. I invested a whole day of training. They actually flew out two people, an optometrist and a
Mm,
trainer that only does this for a whole day. And so it was almost 10 hours, I believe, of practice. And then in the afternoon, we did it on patients as well. We do it on each other, but it definitely is something that the company backs up all of their practitioners. They don't just send the kit and say have fun with it. It's something that we get intense training with. But it was super exciting, and every patient that I've done it on, at first it sounds a little bit daunting, but like I said, they're so excited to actually have the opportunity to have another option in which they can improve their vision or comfort in their lenses.
oh, it's good to know. Very good to know. So when you sit down with a patient and you recommend the scleral lenses, especially via the iPrint, what do you talk to me like I'm a patient? I walk in the door. Let's say I come in and a little bit sensitive, right? Most people don't like people poking around their eyes. You said you're going to put this product on the eye. It's going to harden. It's going to be a little bit of an uncomfortable process. Walk me through that process as a patient. What do I expect? I know you talked about the numbing of the eye, which is, I don't know, is that a little cream you put on the eye? Is that an injection? What are we looking at there?
No, no injections here.
Okay.
So, in general, if you are someone who doesn't like anything to come near or close to your eyes, which honestly is not something that's uncommon, I typically will give you homework at the first office visit to practice by washing your hands and then placing a drop on your finger and touching the white part of the eye, or practicing opening your eyelids with your fingers. And once you become a little bit more comfortable with just opening your eyes or being able to touch the white part of your eye with a gel, then I feel like we get desensitized a little bit, because it is a natural response that as soon as anything gets close, we just want to close our eyes really tightly. That's just a natural thing that we respond with. So I like for people to feel 100% comfortable with those two things first, because it's not something that I don't want to, I'm not here to scare anyone. And if it becomes something that someone is scared on the first visit, then it's a lot harder to overcome. So I like to take those baby steps. The numbing drop does help relax the eyelid, and then I'll always, it's a trick that I use in the office, but if I'm placing a lens on the right eye, I'll tell someone to focus on opening their opposite eye, because then it signals the brain once one eye closes, it wants both to close. So
Mm.
keeping both eyes open and really focusing on it. But I think the most important thing is just really sitting down and taking the time to explain the process. And once someone understands it a little bit more, I show them this is what the goo looks like, touch and feel the lens. But once we go through it and then really focus on the goals or the reason why we're doing it, a lot of times I can get most patients to open up and be willing to try it.
So for someone that's had LASIK surgery, I'd imagine this is a cakewalk compared to that because it wasn't painful or anything. But if I remember, it was a while ago. But I remember it was pretty uncomfortable. There was a lot of pressure on the eye, and then when they did the laser, it was just very awkward. Process is probably not as extreme as that, I'd imagine.
Correct. Yeah. The numbing would be an eye drop, and then there's no like need for really Valium or any other kind of sedatives. It's really just kind of, I think, showing it's a little bit of a new process and a little unknown. So I think that part can bring on a little bit of anxiety. But I actually had a patient yesterday and I asked him to describe it afterwards. And then he was like, oh, yeah, after you did the first one, it was like a breeze. So I think it's really just about like at first feeling the impression. And then once you're like, oh, this is not too bad, then the rest of the process, it seems to be a lot easier.
Very interesting. Speaking of impressions, just a complete side note, I saw a little quick YouTube video the other day. Remember the movie Gangs of New York with Daniel Day-Lewis and Leonardo DiCaprio? Did you see
I
that
think,
movie?
yeah.
So his character, Daniel Day-Lewis, he had a glass eye in the movie, and in this clip, they talked about how to make it look as real as possible, they put some kind of material over his eye to create the glass eye effect. And there was a scene in the movie where he had a knife and he was tapping on the glass eye, and he had to train
Oh my
himself to do
gosh.
that without looking away. So he actually had something over the eye and he was hitting it with a knife. Thought it was fascinating. He's a method actor.
Jeez.
He's one of the best
I
actors.
wonder, yeah, I wonder if he actually did have a scleral lens or something to train himself, but
Yeah.
that sounds cool.
Let me ask you this. For patients that are considering scleral lenses for the first time, what are the red flags they should ask about in terms of these types of lenses? Availability, backup lenses, emergency care?
Yeah, I think some of the things to make sure is that you feel confident with first off, being able to put a lens in the eye. So making sure that you have enough time to practice and then making sure that all at the beginning, like all of your visual goals are something that are discussed because there's so many different ways to create the lenses or to have different things that are options. For example, I might have a police officer that for them, their main thing since they work at nighttime is to have the best distance pair, the best distance, or that glare at nighttime is not an issue. So really focusing, and I'll even ask, what do you do for work or what do you spend most of your time doing? And I really try to hone in on those things. So making sure that it's something that is going to meet your visual goals and place that as number one. Secondly, making sure that it's something that your eye is health wise, it is going to be beneficial as well. I would say there's not too many cases where a scleral lens wouldn't be a great option unless there was an active like infection or something that was being treated specifically that it would be contraindicated. And then one thing that I would like to mention is we don't typically recommend sleeping in contact lenses at all.
Mhm.
So if you know you're that person that you're going to sleep in lenses, this would be like the worst one that I would say because when you sleep with the lens, you lose that saline and it can really cause some damage to the eye. So if you know that you're not someone who's going to be really great at the upkeep and fall asleep in the lens, then I would probably not suggest this kind of lens for you.
So I'm curious because I used to wear way back when in a different life, I used to wear soft contact lenses. And from an application standpoint, you pop them in fine. But when you take them out, you can just reach on it and fold it and it pops out.
Mhm.
Hard lens, how do you get it out? Do you have to like get it from the side and pull it off? Or is it somewhat flexible?
So this is completely like the different thing that we kind of train when you go from soft lenses to hard lenses. So when you actually place the lens in the eye, you actually have to lean forward, tuck your chin in, and be almost parallel to the ground because you
Really?
fill the bowl essentially with saline. And
Oh, okay.
usually you'll have either like a small plunger or sometimes you can make like a tripod because they're so large on your hand to place the lens on the eye. So it's not something where I know some people with a soft contact lens will place it like on the white part of the eye and move it over. It has to go directly in the middle of the eye and bathe it with the saline. As you can imagine, it's a little bit larger and it really does not flex all too much. To remove it, you actually have small devices like small plungers,
Oh,
and we
okay.
place the plunger on the lens and then you can remove it. So there are some patients that actually think it's easier than a soft contact lens because they don't have to drag their finger. It's something they can feel a little bit more tangibly. And the usually the slight suction with the plunger will remove the lens and then the saline comes out as
Interesting. So yeah, it seems like a little bit scary or just a little strange, but anything else, once you get used to it, it's not a big deal, I'd imagine.
Yeah, it's all about practice. And that's why we try to go above and beyond with our training for inserting and removing the lenses. I also like to send home pamphlets because I don't know if you've ever walked down the aisle for looking for contact lens solution or if you remember looking for eye drops. It can be a lot. There are so many different options out there. So I like to equip all my patients with this is exactly what I want you to use. This is the only thing I want you to use specifically for this material. So I try to equip everyone with all the information up front.
Okay. What are some of the most, I know you haven't been doing this too long at the office, but I'm sure you've had some common follow-up issues when a patient is wearing these types of lenses, like leakage, fogging, discomfort. What have you seen since you started putting these in terms of follow-up issues, and how do you typically address those?
Yeah, so I've seen all of those things happen. When you see enough patients, you notice it. And sometimes when we initially see a patient, we might not notice it because these things like such as fogging or leakage, all of these things tend to happen like after wearing for multiple hours. So on my first dispense, when I first give you the lenses and I teach you everything, I like for you to wear them for about a week or two, and then I'll follow up at the end of the day and say, like I start off, just tell me what happened. And usually someone will say either, oh, they're great, I feel super comfortable, or that's when it's the time for them to tell me, like, oh, I noticed a little bit of redness in this corner, or I notice it gets a little bit foggy. And usually these are things that we can work on either with making adjustments to how the lenses are fitting, but then also having that conversation. What are we using to fill the lens with? Are we using the saline that was prescribed? Are we using the cleaning liquid that was prescribed? Because sometimes it's not the lens, but it can also be what we're using with the lenses. And that's why I think all my patients know that I'm very particular with what solutions we're using. And it's very much as like a prescribed cleaning solution and prescribed saline, because
Mm.
it can really make a big difference.
Now, when you talk about making adjustments to how the lens is fitting, how does that work? Are you talking about actually sculpting, crafting a new lens, or making adjustments to the current lens? I'm a little bit lost as to how you would make adjustments if the lens is already done and created. What are you referring to when you say make adjustments to the lens?
Sure. The first lens that is created, it's a little bit different with the traditional method versus the iPrint. But with the traditional method, what we do is we actually create a first lens, which involves all of the pictures and scans, but how the initial lens looked on the eye. Sometimes, even with all the information that we have, sometimes there are some areas that on the lens where the lens is landing on the white part of the eye, it's landing a little bit, if you can imagine, like a little bit too steep, or sometimes it could be a little too flat on that white part of the eye. So I actually speak with a consultation team from the company and tell them what I'm seeing on the lens and how I'd like to design it differently. But also, the white part of the eye is very squishy and malleable. So the reason why I mentioned at the end of the day is that over time it actually squishes down onto the white part of the eye more and more. So that's why I like to see it at the end of the day, because what something after 30 minutes might have looked okay, like not steep enough, then I might need to make some arrangements to those edges. So
Okay.
there is a period of time where we actually consult, and we would send the lenses you have back and create new ones. So it's a very involved process when we're customizing. And this is more so on the traditional side. With the eye print, since it's an exact mold of the eye,
You
we
don't
don't
have that. You
have
don't have
those
that problem
that
as much. Yeah, I got it.
correct.
That makes sense. So, looking ahead, are there any other new technologies out there, or what innovations or trends are you seeing now looking to the future that's exciting you when it comes to this? I imagine that there's unbelievable advances coming with AI, and then also with LASIK and these custom lenses. I can only imagine what we have in store in the future. But what are you seeing that's exciting you?
Yeah, the ability in some patients to be able to get what we call prism, or a
Prism,
way
you
to,
said?
I'm sorry?
You said prism?
Prism, yes. So prism is a special lens that can bend light, and we're finding there are some people who need these prisms for another specific reason, but being able to help patients see more comfortably with these prisms has always been a challenge, and I think that is an area that hopefully will be able to grow. I'm also hopeful that the manufacturing of these will be more quickly. If we could create this 3D device and then have it like printed in the office, right? I've met people who have 3D printers in their homes. So imagine if we could do that in our own offices and have lenses like by the next day. I think something in that area would definitely be the future of where these lenses could really go.
Oh, it's coming. quicker than we could even imagine at this point. So for anyone out there that's listening, that's like me, that as we're having this conversation is thinking, wow, this is something that I could truly benefit from. What's the first step that they should take? And what questions should they ask their eye care professional before committing?
Yeah, I think the first step is always getting an eye exam because that we always want to make sure the health of the eyes look good. But in the eye exam is really that first introduction where you can speak to your optometrist and tell them the parts of your vision that you could make better. I think that's always a good introduction. I think this could be better, or I'm having this difficulty with my contact lenses. And I am always welcome to starting a conversation. Do you think a more specialized lens would be a good option for me? And honestly, I think that would be the first step. There are so many different options. So sometimes as a patient, we can feel lost. So really looking at each person's individual, what their goals are and what their anatomy shows is really the kind of the first way for us to really determine if this would be something that could be beneficial.
Yep. All starts with that initial consultation. And so if you're out there listening to this, and if you're anything like me, which I'm sure there's many people that are, out of sight, out of mind, right? We tend to put these things in the back burner. Like we don't want to get glasses when we get older, right? There's like this resistance that we have. It's this resistance to aging. If I just hold out long enough, I'll be fine. But if you're out there and you're having issues seeing, go to your eye doctor. If it's been a while, you should be going certainly every year, if not every 6 months, just to get a checkup. I guess the older you get, probably more frequently, I'd imagine.
At least once a year, and there's so many different options. Besides glasses, there's contacts and even other new things that are coming out. Don't be scared. I would say first step is just coming in, and you'd be surprised by how many more options, even from the last 2 years. There's so many new things out there.
Absolutely. And we will keep everyone apprised with any new technologies that come out. I think we'll leave it at that. Was there anything else you wanted to touch upon before we wrap this one up, Dr. Madrigal?
No, we're just so excited about this new technology. And if it's something that you want to see, it's something that we could definitely even show you. And we're always happy to take on any questions or anything that anyone has.
Perfect. Yeah. So if you're out there listening and you're having some issues, reach out to the Eye Center. They have a wonderful team right here in Hollywood. So everyone, thanks so much for joining us. If you found this content useful, you know the drill. Don't forget to subscribe, all that fun stuff. If you've had your own experience with any contact lenses, specialty, or even the 3D iPrint process, let us know about it in the comments. We're always interested to hear your feedback. And if there's anything that we maybe missed or anything that you'd like to hear in the future, let us know as well, because we'd love to hear your feedback. And we'll look forward to seeing you next time on the next episode of Insights from the Eye Center. Everyone take care. Have a wonderful day.
Thank you for joining us on Insights from the Eye Center, your guide to clear vision and comprehensive care. For more information, visit eyecenter.com or call 954-432-7711.